Hello, good evening. Finally in the clinic. It feels good to be back. Yeah, for a workaholic person like me sitting at home doing nothing. Nothing as in I was doing things, but not like the patient work. Uh, it's quite frustrating. So, a lot of water is still accumulated in various parts of Dubai. But we could manage to come from the roads which are not in water. My assistant was also able to make it. I'm glad the patients are also able to make it. So just like I have 10, 12 minutes before my next patient arrives, and let's shoot a video. Let's discuss another SBQ, a nice one. Mr. Tran brings in his 18-month-old son, Henry, 18, 1.5-year-old. You know the Tran family well, but see them only sporadically due to their lack of health insurance, mobility, and other life priorities. So basically, these kind of patients will come once in a while. They are not regular attendees. So that means whatever treatment you want to do, maximum you should do it on the visit that they have come because it's difficult for them to come due to various reasons mentioned as and when you want to call them. Overall, the Tran family children are quite healthy. The only significant problems have been with Henry's older sister, who has extensive dental caries, primarily related to the family's poor understanding of the role of preventive care. That means economically they are well, but it's just that they are not well educated about the oral health and the appropriate diet. On examination, you note several white lines on Henry's teeth along with a small early cavity. So basically, you have a patient who's otherwise well-to-do, is healthy in every other way, but just because they don't understand the importance of the oral health, caries is present. So your job should be to educate them so that at least the diet and the hygiene part is taken care of, and make sure you do that in the same visit or whatever short visits that they come for. So let's move ahead and see what kind of questions can be asked. Basically, when you see a question like this where caries is the main keyword, expect on caries risk assessment, expect on fluoride, expect on what treatment you will be doing. Something like this will be there in the question. So let's see. Uh, okay, this is a photo given. You can see the white spots and a small caries out here. I mean, of course, this is an approximate picture. This is not like the exact same exam picture because that's not possible to get. ADC doesn't release the pictures of the exam. First question, what is his caries risk? Now, if the child is just 18 months, where barely the incisors have come out and probably the first primary molar has come out. The canines and the second primary molars are yet to come. And even before all the dentition is out in the mouth, the child has white spot lesions with a cavity, which is like a hole now. It has to be a high caries risk. I mean, it's a simple, straightforward question. There is no doubts about the other options. Directly choose the high caries risk. Now, your decision to apply fluoride varnish should be based upon which of the following statements. So you have to apply fluoride varnish, okay? And why should you decide to apply fluoride varnish? See, first of all, normally fluoride varnish you usually don't apply in children less than 2.5 years old, okay? That's a general rule. But in case you do want to apply to kind of reduce the progression of the existing caries and you want to delay the treatment, that happens only when the child is very young. So what will make me decide to apply fluoride if the child is less than 2.5 years? All children should have fluoride varnish applied at their, well, child visits. I think it means at whatever child visits or regular child visits. All children, no. Like I said, if the child is having a healthy dentition, zero caries by the age of 2.5, you should not be applying fluoride. You should just reinforce the oral hygiene, and later on, when the child becomes older, you can advise or recommend that as a preventive measure. But you don't start applying fluoride just because a small child has come to you. You have to see whether the child is having caries risk or not. This I'm talking about less than 2.5 years. Above that, you can apply that as a preventive measure even if the child is not having a caries risk. That's acceptable. So option A is not entirely true because it says all children. If this option would have said children above the age of 2.5 or 3 years should have fluoride varnish applied at their 6 monthly visits or something, that would have been a correct option. Fluoride varnish will cure Henry's cavity. No, varnish never cures any cavity. It kind of arrests them or it slows down their progression. It helps to remineralize sometimes white spot lesions, but other factors also have to be taken into consideration. But it will not cure any cavity. The white spots on Henry's teeth are an indication for varnish application. That's true. That is a sane option. Fluoride varnish application can be an important source of revenue for your practice. Well, it may be, it may not be, but that should not be a reason to apply the varnish on any patient. Your reason to apply the varnish should be because the child needs it, not because it generates money for you. Now, after consideration, you make a decision to apply fluoride varnish to Henry's teeth. While discussing Henry's treatment plan and obtaining informed consent, Mr. Tran raises concerns about the safety of fluoride varnish. Which of the following statements about the safety of fluoride varnish is most correct? It is risky, but the benefits outweigh the risks. It is not risky. It can cause fluorosis, a serious tooth abnormality. Varnish application cannot cause fluorosis. Fluorosis is caused by systemic ingestion of the fluoride in very high concentrations. As safe as taking a multivitamin pill. Kind of true. As safe as riding in his car seat. How sweet. Riding in the car seat is safe, yes, but I will not choose that as an answer if I have option C available. So, as safe as taking a multivitamin pill is true. Then we have once reassured as to the safety of fluoride varnish, Mr. Tran then inquires, how does fluoride help to protect Henry's teeth? Now he's asking the pathophysiology or the process, the biomechanical process or the biochemical process of how the fluoride works on teeth. The most appropriate response to Mr. Tran's question is, fluoride varnish forms an impenetrable barrier coating teeth similar to wood varnish. Okay. Fluoride varnish eradicates strep mutans bacteria from the mouth. Okay. The fluoride contained in varnish becomes incorporated into tooth enamel and makes it more resistant. Yes, fluoride binds sugar so that they cannot be digested by bacteria in the mouth to create acid. The first option is wrong. The second, it eradicates Streptococcus mutans bacteria. No, nothing can eradicate Streptococcus mutans bacteria. It's a normal flora of the mouth, and only when that increases in its number, caries happens. Along with the key stride or the newborn stride, which is caries, time, saliva, tooth substrate, right? The fluoride content in the varnish becomes incorporated in the tooth enamel and makes it more resistant. Yes, that's the right answer. Fluoroapatite crystals, if you have heard of it. Fluoride binds sugar so that they cannot be digested by bacteria in the mouth to create acid. Wrong. Option C is the right thing. There are 5-6 mechanisms by which fluoride acts, and hydroxyapatite crystal is one of them. Yes, it does interfere a little bit with the process of Streptococcus mutans' ability to convert sugars into carbs, but acid basically. But it's not exactly the way option D is mentioned. Someday we'll just talk about fluoride and its mechanism of action. It's beautiful. Uh, I remember when I was doing my post graduation, and fluoride, of course, was a key subject. The question was caries, like the risk and etc. etc. It's a big essay question. It is a like big question where you have to write almost 8 pages on it. So we had to study about all those studies of caries. those criminal studies, etc., etc. So I had got a book. Shit, I forgot the name only. That book wasn't available anywhere. It was just available in Bangalore in the Bapuji Dental College. So I had to request a friend from there to Nikki Farouk. The book's name is Nikki Farouk. To Xerox that book and courier it to me. So I got that book from there, and such a beautiful book. They had given in depth how fluoride acts, and pages on fluoride research. Lovely book. It's kept in my home in Bombay. This June when I'll be going there, I think I'll carry that book back with me. There are two parts of the book, Nikki Farouk, and perhaps we'll make one session just on the Caries studies. There are studies of, I just forgot the names of it, where children were fed sweets to see if they got caries or not, when caries risk assessment and sugars and carbohydrates were being evaluated, whether sugar is linked to caries or not. And we'll have a separate session on that. It's a very interesting book, and we'll discuss more on the fluoride. Also, that book increased my knowledge of how fluoride acts and how exactly sugars and carbs react, and how tooth is moduled when fluoride is present systemically and topically. Of course, that also helped me become a better clinician, of course, because so many things are mentioned apart from this. It would be lovely to have a nice session on that, and we'll do that. Now that this question has come, it just made me remind of that book. I've kept all my PG level books, I've not given or thrown away any one of them. First of all, I'll never throw a book, but usually I gave away all my undergrad books because might as well somebody reads it, then it kept locked in my cupboard. But all my PG level books are with me, and there were many books with which I had xeroxed from various parts of India because they were not present in our library, and they were really interesting to read, because in PG, when you make articles and you read about something, you just don't stick to your basic textbook. The basic textbook is good to clear your exam, but if you want to know in depth, it's like, suppose a question is asked, how many cars are there? Your textbook will tell you that this many varieties of cars are there. But if you really want to know how a car is made and what was the thought process about making it and what difficulties came in making that car and what was the person thinking and what hurdles he faced, you kind of get the entire story behind it, and somehow you can relate more to that car than you would just by memorizing the names of it. And I'm a person who will go and dig down in that research and try and understand the psychology of the author, what made him do that. And wow, when you had nothing, no technology, no Google, nothing, and they managed to do that kind of research and come out with such good stuff that we, even after having so much of technology, I don't think so new inventions are happening. All the inventions happened even before the technologies were there. They were very smart people. We are nothing. Like, I feel nothing in front of them, but I'm so glad that they did all that research. Their lifetimes went in the research, and we kind of reap the benefits out here. Grateful to all those people who sat and wrote books so it could help us practice. So, anyways, let's go there. And yeah, I'll write on my remarkable that Nikki Farouk is the book that I'm supposed to get from Bombay. I just need an excuse to write on my remarkable, now. So the parent asked about what should be done to the thumb sucking habit. Okay, so apparently the patient is also having a thumb sucking habit. Thumb sucking till the age of 4 to 5 years is okay, though you should encourage the patient to not do it. But beyond that, it becomes problematic because it starts to mold the dentition and creates a narrow upper jaw. It causes cross bite posteriorly, anterior open bite. So, if the parent asks what should be done to the thumb sucking habit, they are asking for Henry, who's 18 months old. Can you tell them ignore? No. Of concern if it persists beyond 5 years of age? Yes. Considered a manifestation of the natural nutritional needs of the patient? No. It's more related to the anxiety, or it's a comfort thing for the child. Considered a primary cause of class 2 division 1 malocclusion? No. It's genetics, hereditary. Answer is of concern if it persists beyond 5 years of age. So I hope this is clear. I would love to talk more, but my receptionist already gave me a missed call saying the patient is here. So that's about it. See you next time. Enjoy. Bye bye.